For years, communities in rural Texas have faced a slow-moving crisis. Their hospitals, if they even have one, are chronically underfunded. In the last 10 years, 27 of them have failed.
This clinic's been closed because we don't have providers to staff it.
The last time I saw Jeff Lyle, who runs the Falls Community Hospital in Central Texas, he was struggling every day to stay open. Falls Community ended 2019 with a razor-thin $14,000 surplus.
Most rural hospitals in this country work on a margin that's between 0 and 1%. And that's not a book of business you necessarily want to go into.
Jeff says the pandemic significantly compounds the financial strain, and here's why. To prepare for infected patients, Governor Greg Abbott has ordered medical facilities to postpone all surgeries and procedures that are not immediately medically necessary. That means rural hospitals are unable to perform services that bring in revenue, while at the same time they're spending unbudgeted money to prepare for COVID-19 cases.
We're back ordered on N95 masks. We're back ordered on regular isolation masks. We're back ordered on gowns, isolation gowns. We're back ordered on face shields.
John Henderson is the president of the Texas Organization of Rural and Community Hospitals.
Does this mean more hospital closures at some point, you think?
I worry about a wave of rural Texas hospital closures in the next month or two. They're struggling to make payroll this week, and they're going to have to go through 3 or 4 more cycles of that.
Henderson says the governor's office is actively discussing financial plans that would support rural hospitals. Hospitals that, for the most part, are not equipped to handle the most critical patients.
How many ventilators are there available for hospitals in rural Texas?
About 3 weeks ago, we anticipated that question and surveyed our members. Among the 157 rural Texas hospitals, we estimate that there are about 300 vents. That's 2 per hospital.
In ordinary times, a rural patient in critical need of a ventilator is transported to a big city hospital for care. But what happens if big city medical centers are too full to relieve the underfunded rural hospitals? It's a question Texas has never had to answer before. I'm David Schechter reporting.